Hi guys, so today I'm going to talk about iron deficiency anemia. So, iron deficiency anemia is one of the most common causes of anemia worldwide. Anemias in general are defined as hemoglobin, the oxygen carrying protein that's in red blood cells, below the standard mean for one's age and gender. This results in reduced oxygen transport in the blood. Now, iron is essential in order to produce hemoglobin. So, therefore, when iron is depleted, it will lead to red blood cells that are microcytic or small or hypochromic pale. This causes reduced oxygen delivery and therefore hypoxia and signs and symptoms related to that hypoxia. Now, IDA is common, ranging from mild to severe, and can occur in all ages with symptoms ranging from asymptomatic to more severe and apparent as that hemoglobin value drops lower and lower. It's important to remember that the disease is frequently a sign of an underlying cause, so it's therefore important to determine what is causing the deficit. Now, in a healthy individual, iron is absorbed in the small intestine or duodenum and transported by transferrin to the bone marrow, where it's used to produce hemoglobin. Hemoglobin, as mentioned earlier, the oxygen carrying component of red blood cells, is what allows efficient oxygen transport from the lungs to the tissues. In someone with iron deficiency anemia, the body's iron stores are depleted due to a variety of reasons, including inadequate intake, absorption issues, or chronic blood loss. As a result, hemoglobin production is impaired, which leads to the formation of small, microcytic, and pale hypochromic red blood cells that carry less oxygen. Now, since oxygen is crucial for cellular energy production, tissues and organs receive insufficient oxygen, which leads to some of those symptoms such as fatigue, weakness, and shortness of breath. As the body tries to compensate by doing mechanisms such as increasing the heart rate, respiratory rate, it further strains the cardiovascular and respiratory systems. Additionally, chronic iron deficiency can lead to impaired enzymatic functions, which can then affect cognitive abilities, immune responses, and thermoregulation. And in severe cases, a symptom known as pica, or craving for non-nutritive substances, such as ice or dirt, can also occur. Now, some risk factors include adolescence, pregnancy, or breastfeeding woman, as these are all periods of increased growth, and with increased growth, the needs for iron increases. If dietary requirements are below what is needed, the individuals will become deficit. Vegans, vegetarians, or individuals with poor dietary habits. So individuals who do not consume enough iron-rich foods such as red meat, leafy green vegetables, and fortified cereals are therefore at risk for iron deficiency. Now, certain digestive system conditions such as celiac disease, Crohn's disease, H. pylori infection, gastritis, or gastric bypass surgery all can hinder the body's ability to absorb dietary iron, which would reduce iron uptake in the small intestine. Heavy menstrual bleeding. This causes blood loss that depletes the iron stores faster than they can be replenished. Gastric bleeding from conditions such as peptic ulcers, colorectal cancer, hemorrhoids, or chronic NSAID use. That leads to chronic bleeding and depletion, similar to heavy menstrual bleeding. Frequent blood donation or post-surgical blood loss. Same thing, leading to continuous iron depletion. The elderly often have poor nutrition, are also often on many medications such as antiplatelets, anticoagulants, anti-inflammatories, even antidepressants that can cause blood loss. Cancer, often poor appetite and poor nutrition, loss of healthy blood cells, damage to bone marrow, or a bleeding tumor. Congestive heart failure can cause reduced appetite, increased risk of GI blood losses from some medications they might be on, such as antiplatelets or anticoagulants, and also decreased GI absorption from edema. Chronic kidney disease, also poor nutrition, reduced GI absorption, and blood loss from dialysis and frequent blood sampling or labs. Inflammatory bowel disease, impaired GI iron absorption due to that chronically inflamed bowel, as well as possible malnutrition. Major signs and symptoms. So, as mentioned earlier, iron deficiency anemia can range from being very mild to very severe. In cases where it is mild, the individuals may remain asymptomatic as the body can temporarily compensate for low iron levels. As that hemoglobin continues to drop lower and lower, the signs and symptoms can be more pronounced due to the body's struggle to deliver oxygen to the tissues and the signs and symptoms of hypoxia starting to show. So pallor or pale skin and mucous membranes. The body first prioritizes blood flow to vital organs such as your brain and your heart. So therefore it reduces circulation to the skin and mucous membranes. This vasoconstriction leads to a paler complex, particularly noticeable in the face, lips, gum, and nail beds. And often, pallor is one of the first signs and symptoms that can be seen. Fatigue, lethargy, and cold intolerance. Iron's essential for that cellular metabolism and ATP energy production. In the deficiency, oxygen transport is impaired, which causes a slowdown in the cellular energy production. As a result, individuals may feel constantly tired, weak, and have difficulty with thermal regulation or tolerating cold temperatures. Irritability and cognitive changes. The brain is highly sensitive to oxygen deprivation, so even a slight reduction in oxygen levels can affect neurotransmitter function and can lead to mood changes, irritability, difficulty concentrating, and memory problems. Degenerative changes in hair and nails. Keratin-producing cells require iron for proper growth. When iron is deficit, your hair can become brittle and prone to falling out, and nails often develop spoon-shaped deformities with ridges due to that weakness of the structural integrity. Stomatitis and glossitis, which is inflammation of the mouth and tongue. Lack of iron affects tissue repair and immune functions, which can lead to that inflammation. It can cause pain, redness, swelling, and even in severe cases, difficulty swallowing. Menstrual irregularities. Iron deficiency can disrupt the hormonal balance required for normal menstrual cycles. This can lead to irregular or absent periods, particularly when the iron deficiency is severe. Tachycardia, heart palpitations, dyspnea, and syncope. The heart compensates for those lower levels of oxygen by pumping blood faster, which is tachycardia, to try to deliver more oxygen to the tissues. It can lead to irregular heartbeats or palpitations, shortness of breath, dizziness, and even fainting in severe cases. And often individuals will notice this when they're working out or exerting a lot of energy, finding it more difficult to make it through their typical workouts than it was before. So here is an image which goes over some of the common signs and symptoms, as well as some iron-rich foods, which is beef, liver, chicken, eggs, shrimp, apricot, raisins, leafy green vegetables like spinach, broccoli, dried beans, potatoes, and fortified cereals. So, diagnostic testing requires comprehensive labs, including a CBC, iron studies, microscopic evaluation of red blood cells, and additional diagnostic markers. So, CBC is the first line test. It reveals abnormalities in the red blood cell parameters. Findings typically include a low hemoglobin, less than 130 in men or 120 in women. Low hematocrit, which is the proportion of red blood cells in the blood is reduced. Low mean corpuscular volume. Red blood cells appear microcytic or smaller than normal, typically less than 80. Low mean corpuscular hemoglobin and mean corpuscular hemoglobin concentration. Red blood cells contain less hemoglobin, causing hypochromia or that pale appearance, and increased red cell distribution width or RDW. Anisocytosis or variation in red blood cell sizes is commonly observed, indicating an elevated RDW. Next is a peripheral blood smear, which is a microscopic examination of red blood cells, which reveals those smaller red blood cells, those red blood cells that are paler due to the low hemoglobin content, and irregular red blood cell sizes. Iron studies and serum markers. These are iron-related specific tests, which are essential to confirm iron deficiency and evaluate the iron storage levels. So low serum ferritin. Ferritin is the body's iron storage protein. So when its levels fall below 30, it typically confirms that there is iron deficiency going on or low stores of iron. Also making it difficult to diagnose iron deficiency is that ferritin is also a reactant that increases with inflammation. So a lot of comorbidities of chronic diseases is iron deficiency anemia, which also produces some of the same signs and symptoms, which can make it difficult to differentiate between the two. Low serum iron, which is the circulating iron levels. They're reduced due to the depleted iron stores. Low transferrin saturation, typically it's less than 20% in order to be considered for an IDA diagnosis. And high total iron binding capacity. Since the iron stores are depleted, the body increases transferrin production, leading to elevated TIBC. Lastly, a stool blood test to determine if there's blood in the stool, since chronic blood loss is a common cause of IDA. This typically will indicate if it's a gastrointestinal source, such as peptic ulcers, colorectal cancer, or inflammatory bowel disease. If there is a positive fecal blood test, it requires further investigation, such as doing things such as endoscopies or colonoscopies to get to the source of what's causing the issue.